Good evening. My name is Hillary Epps and I'm an MSN student at Auburn University. Today I'm going to talk to you about the COVID-19 pandemic and its impact on healthcare professionals and healthcare organizations. This brief video will help healthcare organizations make decisions regarding resources they can use to provide to ensure mental and physical well-being of all of their employees during this unprecedented, difficult time. According to the CDC, there have been more than 10 million Americans test positive for coronavirus, with a total of nearly 240,000 deaths. There were 134,000 new cases just since November 11th alone, with a 7-day moving average of 121,000. This increase in cases has put extreme stress on healthcare systems as a whole, as well as healthcare professionals. The increase in patient population means that the healthcare professionals not only have to worry about their current patients, but the availability of equipment needed to give their patient the best quality of care. And keeping non-COVID patients safe, keeping the healthcare workers' family members safe, and worrying about the well-being of patients who are unable to get a bed due to the shortages caused by the COVID-19 pandemic. Some studies have shown that direct contact with patients infected with COVID-19 increases the physical and emotional demands of healthcare professionals. These healthcare professionals are at an increased risk of not only contracting COVID-19, but also of increased stress and anxiety and lack of sufficient staffing on their floors. These workers exhibit and self-report feelings of anxiety, depression, fear. Some even report substance abuse and, in the worst cases, suicidal behavior. These symptoms can clearly have an adverse effect on patient care and should be taken very seriously. I believe that healthcare organizations should emphasize and prioritize mental health of all of their healthcare workers. While it's important for healthcare providers to be proactive and take responsibility by using coping mechanisms such as exercise, yoga, meditation, and self-reflection, it is important that healthcare organizations promote programs and services to their employees to help manage the adverse effects of this pandemic. These services and programs can include wellness videos, online support groups, and group or individual counseling and therapy, just to name a few. Healthcare providers and healthcare systems should review the SARS pandemic back in 2010. This can be used to show the negative impacts on healthcare professionals when mental health of employees is not the priority of an organization. Follow-up studies show that distress such as burnout, increased substance abuse, and PTSD were all still present for up to 2 years after the pandemic had ended. When healthcare workers are expected to make rapid, ethical, and challenging decisions on a daily basis, it is important that their judgment is not clouded. This is why I believe that it is absolutely imperative that healthcare systems and organizations and healthcare professionals provide psychological services to all healthcare professionals during this global pandemic to help improve their skills at managing stress and their overall mental health, so as not to adversely affect any patient care. Thank you.